As the leader of the Department of Human Services, I can speak from personal experience about the impact of child abuse and neglect in a community and in a society. I am a former child protection worker along the way, and I'm definitely intimately familiar with the challenges that we're facing here and what we can do to make it better and to improve the situation. Over the past 10 to 15 years, there's really been a lot of data emerging about the damage of child abuse and neglect and about adverse childhood experiences. I'm sure a lot of people in the room recognize that. But simply put, people who have these serious negative childhood experiences are really, they're going to have a challenging time with life. The data is very clear that children who suffer adverse childhood experiences really have more to tackle on their plate as adults. Some interesting things that our intuition tells us are being proven out. You know, depression, alcohol and drug abuse, unsafe sexual behaviors, and domestic violence are all more prevalent among children who have been abused and neglected. Some things that maybe aren't as intuitive, chronic diseases like COPD, chronic obstructive pulmonary disorder, IHD, ischemic heart disease. These are all also more prevalent among kids who have been harmed when they were young. And what we learn there is the link between biopsychosocial, emotional health. Kids who are harmed have other impacts besides just the physical that they're going to be carried with them throughout life. We know intuitively that children suffering from abuse and neglect is a significant problem for our society and also for our community, and that data can't be a more clear affirmation that our intuition is right. We need to do something, which is why we're here today. The people in this room have spent many hours individually and hundreds, if not thousands of hours collectively, probably into the several thousands, honestly, to develop community-wide efforts and collaborations which we can use to bend this curve, to really impact positively the safety of our children, to protect and better set up our youth for better success as adults and intervene on some of those cycles that the video did a great job of really spelling out clearly. The goal is enormous, but the efforts of this group are one step in interrupting and reversing a cycle of behavior that harms and traps many, many families. Thanks again for your work on this task force. Our collective efforts will make a difference. Thank you.